Hey everyone, my name's Sarah Lavonne and welcome back to my YouTube channel. It is June and therefore this month is ICP Awareness Month. And so in honor of cholestasis of pregnancy, we are gonna talk all about it. I wanna teach you what it is, its instance, what causes it, what we're looking for, what it looks like for your labor and birth, and then how it resolves itself. So if you haven't heard of this, stay tuned because I'm gonna let you know all about intrahepatic cholestasis of pregnancy, which is a complication that can happen really towards the end of your pregnancy. But before I get started, make sure you subscribe down below, give it a like, share it with a friend, and then let's talk cholestasis. For the majority of pregnancies, you have what we call an uncomplicated pregnancy. But in some of your pregnancies, there are certain complications that can arise and that do require some medical attention. One of those is what's called intrahepatic cholestasis of pregnancy. This is abbreviated ICP, or us medical people, we just call it cholestasis. And so today I want to talk all about it. I want to give you an idea of what you're looking for because cholestasis is really tricky. It may only have one random symptom that I'm going to tell you in a second that feels like it's no big deal. And in fact, just recently I had a client reach out to me and tell me that they had really itchy hands and feet. And they were like, this is normal, right? But I can't stop itching my hands and feet. And I was like, ding, ding, ding. No, actually, let's have you go in and call your doctor about it. Sure enough, they called her in, they did some labs, and she had cholestasis of pregnancy. And so the classic sign of cholestasis is what I just said, is itchiness. Now, this is itchiness without a rash because a POPS of pregnancy or a pregnancy rash is totally different. But if you are finding that particularly your hands and your feet are super itchy, all you have to do is call your doctor and say, hey, my hands are really itchy. This is normally second and third trimester. Very, very, very rarely would it ever be first trimester. And likely what they're gonna have you do is come in and get your labs drawn, meaning draw some blood to check a serum bile acid level. So if we break down the word cholestasis of pregnancy or intrahepatic, this is hepatic disease. So this is related to your liver. We don't really know why it happens, but we know that the incidence ranges to somewhere amongst, and this is a crazy range, less than 1% to 27.6% of pregnancies. Again, we don't totally understand why it happens. And depending on the population you're looking at and whatnot, the ranges can really vary, where this can be really not common to somewhat common. I will say for me, this is a somewhat common complication that I see amongst my clients. I saw amongst my patients when I was in the hospital as a nurse. And the other news about this is that if you had it, it has a very high recurrence rate in pregnancy. So if you've had it before, you're 60 to 70% likely to have it again. Again, for reasons that we don't totally understand. Now, if we're really looking at what we think are the causes, we don't totally know, okay? So that's sort of like the blanket statement, but we think it's a combination of some genetic factors. So this is nothing you can control just based on your genes. And then they actually think that there is some environmental factors that contribute to your chance of getting cholestasis. And so they found that actually certain places in the world have a higher instance of it, possibly related to lack of sunlight. So in your pregnancy / our lives, we need sunlight. We got to get outside. They say 12 minutes a day in the sunlight or indirect sunlight is really good for your vitamin D levels. The other thing that is a contributing factor is your hormones. And we're going to blame estrogen here. And estrogen is the female hormone. It peaks in the second trimester. And they see that when that estrogen level ends up being really high, that can contribute to a cholestasis. There might be some progesterone thrown in there, but some sort of hormone situation can cause this complication of pregnancy, none of which is under really your control other than maybe the sunlight thing. So if you're like, oh my gosh, I haven't gotten outside, get outside every so often. It's just good for us in general. So the primary sign of cholestasis of pregnancy is itchiness. particularly on the hands and feet. A lot of times it gets worse at night. That's a lot of times what is the like triggering thing for people where they're like, dude, I'm so itchy. And that alerts them to go get their labs taken. But the other component, and really the diagnostic factor, so how we know you have a cholestasis, you have itchy hands and feet and your labs are normal, you don't have cholestasis. But the moment we know that you have elevated bile acids, that's what's gonna rule you in for a cholestasis of pregnancy. And I'm getting to what this looks like for your birth, so stay tuned, okay? But for those of you that are interested in understanding a little bit more of the pathophysiology of this with the bile acids flow out of the liver. Our liver is like a filtration device for toxins and other things, right? And it's working to kind of clean out our system. Bile acids, we know, help with digestion. They help us absorb fat in the intestines, and then they help regulate our cholesterol levels. So it's sort of like this digestive component to our body. Now, where this really matters is that these bile acids, I want you to imagine, they're like little crystals in the blood. And this is not an exact explanation of what happens, but for a visualization to help you understand that in the body, your body doesn't want, or say in your blood, you want your blood to be like smooth, super liquid, right? And so what happens is that normally your bile acids don't cross through the placenta. They don't accumulate in your body. They get filtered out. But in a cholestasis, they actually collect in the body of the mom, and then therefore they can cross the placenta and accumulate in the amniotic fluid and into your baby, which is where we start to get concerned, particularly for your baby. So when we talk about complications, we're not really as concerned about you as the pregnant person. We're really worried about the health and safety of your baby. Okay, so what does this mean for your baby? And this is the not so fun stuff. Now, when we don't know it's happening, so there is hope here, all right? There is medications, I'm coming to that, and there's a plan in place, all right? But in the case that your cholestasis goes unrecognized, you ignore the itchy hands and feet, your doctor decides they don't want to draw labs. This is where, like, if you're having those symptoms, have them draw that bile acid level to be sure, because you are 3 times higher chance to have what we call a fetal demise. And so imagine those little crystals in the blood, they cross through the placenta into the baby, and then their blood isn't smooth and healthy. It can accumulate and actually potentially lead to a fetal demise. That's our biggest, meaning like your baby not surviving, okay? That's our biggest concern. That's what we want to avoid, which is why we're paying such close attention to it. The other sort of complication that can result from a cholestasis, or that's correlated, is there's around a 57% chance of meconium stained amniotic fluid. What that means is that your baby pooped inside. And I actually have a video on meconium, so you can check that out if you want to learn more about that. Not ideal, not the end of the world, but also not ideal and can lead to complications, particularly respiratory or breathing complications with your baby. There's a 3 times higher chance of preterm birth, and then there's higher chance of what we call neonatal respiratory distress syndrome, which is really when the bile acids, imagine those little crystals enter the lungs, it causes problems with the baby breathing. We love babies breathing. That's the biggest thing we're concerned about when they go from not using their lungs and breathing in oxygen inside the womb to now having to breathe on their own because they're no longer connected to the placenta. So we want them breathing, and so there's a higher chance of that, which is why we want to be paying attention. So what happens if you're diagnosed with a cholestasis of pregnancy, all right? So depending on where you're at in your pregnancy, ideally, we want to get you to 36 to 37 weeks of pregnancy. Say you're diagnosed at 32, you're going to be looking at probably a 2 times a week visit to your doctor. You're going to be doing your kick counts, which I have a video on that. And then around that 36 to 37 week of pregnancy, which by the way, 40 weeks is your due date. So we're talking 3 to 4 weeks early, you are probably getting induced because of that risk of fetal death. Okay, or neonatal death, fetal demise. All right, so because of that, we want to have a baby early because it's not going to resolve until you've had the baby. And you can take some meds. There are treatment medications that they can put you on potentially, depending on where you're at in your pregnancy. But they're going to be watching your labs. They're going to be looking at your liver enzymes, because also your liver labs, we'll say, can be elevated as well, which can lead to other complications. And so as they watch you closely, you're anticipating, look, I'm diagnosed at 34 weeks. I am not keeping my baby in until 40 weeks. I am looking at an induction around 37 weeks. I have clients that text me and they're like devastated because they wanted to go into labor on their own. And they're like, is it really necessary? And my answer is, this is one of those circumstances with an induction of labor that is just not worth it to push. All right. The risks are clear that by pushing it past that 37-week mark, the really clear concern is fetal demise. All right. We want you to have a healthy baby. And so therefore, this is where we're weighing risk benefits and we're saying, okay, like what can I control and what can't I control? And in this case of the cholestasis of pregnancy, you're having a 37-week induction. Obviously, this is within your control, but this is where for me, it's like with my clients, I'm like, look, this is great. We're going to have a baby. And we start shifting our perspective around that 37-week induction. So what does your birth look like with a cholestasis of pregnancy? Because with that induction of labor, that's number one. That's usually how I prep my clients that like, yay, we're having a baby at 37 weeks. Let's start to prep for induction. I have 2 induction videos. I have an entire medical interventions class, labor prep class that can help you to prepare for that. But I think a lot of times whenever there's a complication, when there's something new, when there's something unknown, unexpected, that you get to be like, my birth plan's out the window, or I can't do anything anymore. And really, the only difference is that you're being induced at 37 weeks. So that induction does lead to a different birth experience, but can you move around? Can you breathe? Can you get your epidural? Can you get in the shower, likely with monitors because you're being induced? But other than that, like everything else about the birth is normal. So again, this is that like lesson that I talk about very consistently, and that's a good life lesson that we pick up what we can control and then we let go of the rest. So what are the things you want to maintain? Setting your environment, having the people there, knowing what's coming with your induction. What do you want to smell? What do you want to taste? Where do you want to move, etc. are all still within your control. All right. Now, related to postpartum, the other concern that I hear is, can I breastfeed? I had this cholestasis thing. Once baby is out, we are likely good to go. All right. So they may monitor you, but other than that, it resolves after you have your baby and you absolutely can breastfeed. If anyone tells you otherwise, there's no contraindication or no concern with you having cholestasis of pregnancy and breastfeeding your baby. So you breastfeed, you do skin to skin. To me, there are a lot of complications that can happen during labor, birth, pregnancy, postpartum. This is one of those that, other than the 37-week induction, and yes, in circumstances where you have a poor outcome, it is devastating. But for the most part, if you're paying attention to your symptoms and you get those bile acids drawn most of the time, and that may be the only clinical finding that they find that is like, oh, look, you have cholestasis, and you're following the doctor's recommendations, this really doesn't have to be the biggest deal in the world. There are other complications that don't resolve right away after baby, or that you have to continue watching for signs. This one, you get to the hospital, you get on the fetal monitor, you get induced. That's really all, okay? So you can still maintain a whole lot, skin to skin, breastfeeding, all of that. And then once you deliver, it's like, oh, we're over that. It's intrahepatic cholestasis of pregnancy. You're no longer pregnant. We've moved on from our cholestasis. Thanks everyone for being with me here today. I hope you found that really helpful. I hope that you learned something new, and especially for those of you that are pregnant or know someone who's pregnant or maybe have a partner that's pregnant, that pay attention to that itchy hands and feet. I don't want you obsessing, all right? Because some itchiness, I know the other day I was like, why are my hands and feet so itchy? And I thought to myself, like, I'm not pregnant, but all of a sudden, like, my mind goes to cholestasis. It doesn't necessarily mean that you have cholestasis. There's other things that can happen in your pregnancy, but that is one of those signs that we don't want you to go unnoticed. We want you to report to your provider, give them a quick call. They'll likely run some labs, and then we're either in the clear or they keep watching it, or you have a cholestasis and you can anticipate your 37-week induction. If you want more from me, you can check out the description box down below. Everything's over at bundlebirth.com. Make sure you subscribe, follow me on Instagram. Let me know what you learned down in the comment box down below. If you have other questions, comment down below and I may be back for a coffee and questions and get to answer your follow-up questions related to this and other things related to labor, birth, and parenting. Thank you for being here. And then until next time, don't forget to flex and flow, and I will see you soon. Bye.